would like to say Asante Sana for giving me the opportunity to stand in front of you. And there is a very lovely saying I read, I don't know the exact time, but it's in my head. It says like, if we could see further, it's because we are on the shoulder of giants, and the giants I am in is over there. I would like to say thank you to Dr. Salamoid, who introduced me to AGMHI and helped me to get this opportunity, and even to came out from my country for the first time, and I'm excited for that, meeting so many people. So I would like to say Asante Sana for the participants of the research who are residents in St. Paul Specialized Hospital in Addis Ababa, Ethiopia. And also I would like to say thank you to my mentor, again, Dr. Salamawit, and also Dr. Solomon, who were the advisors of my research, and to St. Paul Hospital Millennium Medical College in Addis Ababa, and AGMHI for the opportunity. So let me proceed. So my research title is Problematic Internet Use and its Associated Factors Among Resident Physicians at St. Paul's Hospital Millennium Medical College in Addis Ababa, Ethiopia. It was a cross-sectional study. It was actually I graduated like 2 weeks or 3 weeks back officially. So this is my thesis. Thank you so much. So problematic internet, so the giant is now clear. Problematic internet use is excessive and impulsive internet use that leads to negative life outcomes, and no research was done among medical residents in Ethiopia and few globally too. So the general objective of the study was to assess problematic internet use, its prevalence and factors among resident physicians at St. Paul Hospital from September 1 to November 25, 2023. And the specific objectives were to determine the prevalence and the associated factors. So from literature review, the conceptual framework, as you can see here, the dependent factor was problematic internet use, and the independent factors, the socio-demographic and socio-economic characteristics, age, sex, educational status, marital status, and the internet use experience, common mode of internet use in hours per day, basic purpose of using the internet, and academic achievement, and the other side, substance use like tobacco, alcohol, caffeinated drinks, and psychosocial factors, including depression, anxiety, sleep quality, duration, and suicide. So the methodology was an institutional-based cross-sectional study conducted among resident physicians at St. Paul, and the sampling method was multi-stage stratified sampling technique. The data collection tools were socio-demographic informations, the 20-item Young Internet Addiction Test, PHQ-9, the GAD-7, and Pittsburgh Sleep Quality Index. And the inclusion criteria were all medical residents at St. Paul who were asked to participate in the study based on their consent. And the exclusion criteria were the residents who were absent at the study site and refused the purpose of the study. So the finding was this: the prevalence of problematic internet use was found to be 46.6% with 95% confidence, between 41.7 and 51.6%. And from this, 0.5% were having severe problematic internet use, and 9.2% were having moderate, and 37% were having severe problematic internet use. So the data, the multivariable logistic regression shows that being married and being in the departments of obstetrics and gynecology as a resident, and sleep internet use per day of 5 or more hours, and hours of actual sleep per night of 7 or more, and depression were significantly associated with problematic internet use in this study. And this finding is comparable with 51% and 41.3% among medical students in Pakistan and Delhi, respectively. And this can be explained due to the same study population and the method, the Young Internet Addiction Test. And this is relatively higher than among medical and nursing students at the Uniformed Service University, where the prevalence was found to be 5.5%. And among resident doctors in North India Tertiary Care Hospital, which was 8.24%, and lower than the 79% among undergraduate students at Ambo University in Ethiopia. And the explanation can be cultural variations in time utilization, internet access, and policies towards internet and variable sample size. And also in this study, singles showed higher problematic internet use, which is similar to the findings among medical students in Western Iran and Iranian university students. And this can be explained by singles have more leisure time. And 68% reduction in problematic internet use odds among OBGY residents compared to anesthesiology, and problematic internet use and specialty. They have a correlation. The correlation between these two were found among Western Iranian medical students. And to confirm this, we recommend a larger sample size for the underlying mechanism to be discovered. So more time on the internet also were found to have 2 times the odds of problematic internet use. This is in line with Western Iran medical students, and this may be both a symptom or the cause of problematic internet use. And fewer hours of sleep per night increased problematic internet use, and this aligns with medical and nursing students in San Diego. This can be also explained by the time displacement theory. As we use more internet, our sleep also decreases. And finally, depression was associated with problematic internet use, and this is in agreement with the finding from Jimma University in Ethiopia, and among resident doctors in North India, and among adults in 15 countries. And this can be due to a reciprocal relationship between depression and problematic internet use. So the limitations of the study: this is just a single a study done in a single college, and there might be a recall bias it's cross-sectional, and CAT use was not assessed, and the cross-sectional nature doesn't give us the causality relationship. So in conclusion, problematic internet use among medical residents in Ethiopia is high and linked to psychological conditions, and it needs for targeted interventions, support systems, and education. So my recommendations include the Minister of Health and policymakers to design national guidelines and policies to fund and promote awareness campaigns. And this is a picture of me. I think Dr. Salama, it is not visible. We organized an awareness campaign like this. Are parents of students of high school in Addis Ababa. Around 1,200 parents. We were we were discussing about problematic internet use among their children, and to support for the healthcare professionals to integrate screening and intervention, and to set a positive example by having a healthy digital life. And for medical residents, we recommend to practice time management and to explore alternative activities like exercise and socializing more, and to seek help and support whenever it's needed. And for the internet providers in Ethiopia, which are the Ethio Telecom and Safaricom, actually Safaricom is the recent one, so to provide educational workshop and to provide resources and to promote digital mindfulness campaigns, and for future researchers to have a larger longitudinal studies and to see the causality and other gaps in this study. So here is my references. Karibu.